Respiratory infections are on the rise across the country, and one of them is whooping cough.
KCRA3's Danica Hill joins us live from the newsroom to break down the numbers. Danica, what are doctors saying about the cases?
Yeah, the doctor I talked to today says right now it's too early to say we're seeing an upward trend. However, he says any increase in case numbers can be concerning. So let's take a look at the numbers that we're seeing. According to the California Department of Health, in 2023, the state saw 435 whooping cough cases. Now that's 143 more cases than in 2022 and 240 more cases than in 2021. Now, while these numbers are an increase, it's a stark difference than the numbers that we saw in 2018 and 2019, where we saw cases in the thousands then. In general, doctors say this is the time of year where we start to see more respiratory illnesses spreading, especially after the holidays. Now, whooping cough typically affects those babies and those 65 and older. However, the doctor I talked to today says just because you're young and healthy doesn't mean you should avoid taking those proper precautions.
You never know who's around you that's sick, and while you're young and healthy, you could still get any of these infections and you're not going to feel great during that time frame. Additionally, it's not just about you, but the people around you. You may interact with young kids. You may interact with grandparents, aunts, uncles that are in higher risk categories. You may interact with people with heart disease, lung disease, diabetes, individuals that are considered overweight. All of those groups are at higher risk of infection. So you'll be protecting yourself, but also protecting your loved ones and other people that you interact with.
Now, Dr. Hakeem encourages everyone to talk to your doctors about what vaccines is best for you. Now, I have more on the symptoms to look out for tonight at 7. Live here in the newsroom, Danica Hill, KCRA 3 News.
Danica, did he mention anything about people getting vaccinated? Is that contributing to the number of cases we're seeing?
He said surprisingly, he is seeing a steady number of people getting the flu vaccine and asking about RSV vaccines. He believes the part of the reason that we are seeing a rise in cases are just because people aren't taking the same precautions they were during the pandemic, like washing your hands, staying at least 6 feet apart from each other, and people aren't staying home as much when they're sick. He says all of these things are adding to the number of viruses that we're seeing spreading.
All right, Danica.